And I just want to welcome you all for attending CCDPH's September School Health Meeting. This is our first meeting of the school year. Let me mute this person. This is our first meeting of the school year, and I wanted to introduce myself for all of the people who are new to joining us. My name is Kelly Jones. I am a health educator with Cook County Health Department, and I lead school health for Cook County Health Department, and I host these meetings, and I am very happy to see you all. We appreciate your continued support and your partnership, and I am thrilled that you are still here. I'm going to see, oh, I see that Dr. Joshi is here. So I'm going to welcome Dr. Kiran Joshi, who is our Senior Medical Officer for Cook County Health Department, and he'd like to say a few words to you. Hi, Dr. Joshi.
Hi, Kelly. Good to see you. Good to see you all. I know we're well into September at this point, and some of you may have been back in school for weeks, if not a month. I know my kids have. It's so wonderful to be back here with you all. I just want to say I'm so thankful to you all for making the time to be with us this afternoon, and also to say we truly appreciate everything you do in our communities, in our schools, to make sure that our kids are safe and healthy and thriving. So thank you once again. Really appreciate you all, and looking forward to this meeting. Thanks, and back to you, Kelly.
Thank you, Dr. Joshi. I also echo his sentiments. We couldn't do this without you, and we appreciate your partnership. Let's get going with our agenda. Our meeting objectives are to share information and updates and resources to help schools navigate issues related to school health and wellness, answer any frequently asked questions, and provide CCDPH contact information and resources. Our webinars are all recorded and they are uploaded to our website as well as CCDPH's YouTube page. Please keep your lines muted. I know that for some, when you enter Teams, it shocks you with an unmute, but we want to make sure that everyone can hear uninterrupted. So please keep your lines muted. And if you have any questions, feel free to put them in the chat, and our team will make sure we get your questions answered during our meeting. Here is our agenda for today. We had our greeting from Dr. Joshi, our leadership. We have some announcements and some resources. We will talk to you about our community needs survey, an update from our communicable disease department. Our chronic disease department has an update, and then we will hear from our esteemed partners, Illinois chapter of American Academy of Pediatrics. We'll talk to you about their statewide efforts for vaccination resources, and we are eager to get started. A few announcements. Here is our contact information for CCDPH. If you have any medication requests, webinar related questions, or general questions, you can send them to our Healthy Cook email. If you'd like to report line lists, report any communicable diseases, or have any metrics questions, that goes to our communicable disease unit, and their email address is as follows, along with our information on our CCDPH website, school page, and our COVID-19 vaccine website. Here is information on Cook County Health's clinics. We do not turn anyone away for their inability to pay or lack of insurance. If you know someone who could use healthcare services, here's a list of our healthcare clinics and options. Also new to Cook County Health are the ability to have virtual wellness at CCH, and that's available to kids and adults. As we have stated, no one is turned away for their inability to pay. So I hope that the community can use this resource. And I'd like to introduce Dolores Walker, who is our Regional Health Officer for Cook County Health Department, and she'd just like to talk to you about our community needs survey. Dolores, are you on?
I am on. Good afternoon, Kelly, and good afternoon, everyone. Thank you so much for attending today. I'm just going to take like 1 to 2 minutes to share some information about the survey that we are asking for your assistance and really pushing out and also completing. So this is our community input survey. It's through the Alliance for Health Equity, which Cook County Department of Public Health is a part of. And this survey helps to inform our community health assessment. And so, what we do, why it matters, kind of thing. I just want to share that and then share some key dates. So, we're doing this because this does, like I said, it helps inform our community health assessment that we do every 5 years. And after we do our assessment, then we complete a community health improvement plan. This is not done in isolation. This is done in conjunction with community as an entire public health system. And so, as we know, the school system, the education system is a huge sector when we talk about the health outcomes, healthy outcomes for our residents of suburban Cook County. So, what I'm asking is that you all really, in whatever way you can, if it is a digital backpack, if it's a school newsletter, an email blast for your school districts, if you can share this survey to try to increase the responses for the survey. It is really critical that we hear from you, because what happens is this survey helps to really helps us to understand how we should allocate resources and which direction we should go. And just as a quick, just so you know, kind of success story, our behavioral health unit is a direct result of hearing from our partners, hearing from our communities on what is important to them. And so, behavioral health and mental health resources and access is one of our current health priorities. So, this survey helps us to, in turn, set those priorities for the next 5 years. And so, with that, I just want to say a couple of key dates. So, this survey we are in the home stretch for this. So, it's September 30th that this survey closes. So if you can, get this out as best as you can within the next 2 weeks, we will really appreciate your partnership on it. And then the other thing is that we are looking for focus groups. So if your organizations, your schools, your school districts, any parent groups that you might facilitate or know of are interested in being a focus group, please reach out to me. The focus groups those deadlines have been extended to October 31st, so we still have some time. Kelly, I don't know if you have my contact information on the slide, but I'll put it. Are you able to put it? I can put it in the chat. I'll put my email
Please
address in
do.
the chat for anyone that has any questions or is interested in hosting a focus group. Thank you so much for your time and attention. I appreciate it. Have a great weekend, everybody. I'm still on the call, but have a great weekend.
Thanks, Dolores. I see I have a few slides that I prepared that somehow got hidden, so I'm going to see if I can show them anyway. Please let me know that you can see this slide and then it's not hidden from you. You can see it, Marcia. Good. Thank you for the head nod. So this will be my last meeting until next year. I will be out of the office starting next month, and I'll miss you all dearly. In my absence, Marcia McCullough, Stacy Diggs Spence, and Alicia Boyd will be covering the school health meetings and helping to continue our engagement. I would like for Marcia and Alicia and Stacy to please come on camera and introduce themselves so that you guys can see their beautiful faces and know who you'll be communicating with during that time. So Marcia is waving. Is Alicia and Stacy available to introduce themselves as well? You're unmuted, Marcia. Go ahead.
Okay. Good afternoon, everybody. Looking forward to working with Kelly and Alicia and Stacy to make this thing happen. Kelly has done such an awesome job, and so for me, I'm looking forward to gaining the knowledge of technology because she has become 3 or 4 people in doing this. So we're going to try to make it happen. So stay tuned.
You guys will be great. Stacy, did you want to say hello to everyone? Thank you, Marcia.
Hi everyone. I'm on the team with Kelly. Um, I would like Marsha could have said it say it best that it's that yeah. Kelly has done an absolutely phenomenal job.
Thank you all. I appreciate it. I don't know if Alicia had to hop off, but if Alicia is still here, we'll give her opportunity later on in the meeting. Let's keep going. Thank you all. So we also have some changes. And normally when we have the meeting, I try to email out the slides. And I guess to the detriment of it becoming popular, it's been harder to send those slides out because they're getting too large and they've been bouncing back. So in an effort to streamline and make sure that everyone receives the information, we have created a CCDPH SharePoint site. So here's just a screenshot of what it looks like. So the screenshot is going to be your one-stop shop to have all of the information for school health. As you can see, the banner above, it has a homepage with information. It has the links to the previously recorded webinars. It has links to, as you can see here, these are all the webinars that are scheduled. Scheduling links are here, and you'll be able to get all your resources and handouts from one place. And you can reach that whenever you want to instead of me emailing them out. So our communications is working on getting this live. We hope to get it live next week. And then I will send out a link to all of the people who have registered. And then you will be able to access all of the information and all of the information from our meetings without me sending them out. And I hope that will help streamline the process and give you guys better access to the information. Let's keep going. I found this great resource. I was watching GMA, and I'm always doing my job, even when I'm not doing my job. And Matthew McConaughey was on there talking about this grant funding project that's available to schools. Most schools do not know about it. And the grant funding ends in 2026. And I thought it was a phenomenal opportunity for schools to take advantage of it. So I'm going to play the YouTube sort of advertisement, and I hope everyone takes advantage of it and shares all of this information. And let's pray that YouTube doesn't give us a ad and we can go straight into it.
Kelly, can you share your sound?
Oh, the sound isn't playing. I'm sorry about that. Let's try again. Thank you for letting me know, Alicia. You know, I don't see where I can do that here. I'm sorry, who's talking? I'm sorry.
This is Michelle Miles. I could hear it, but my volume was only up 21%. So I don't know, maybe because of the location of where I'm at, but I could hear it fine.
I also heard it. This is Amy.
I thought that was a fantastic program. And they even had a whole segment with school administrators who've taken advantage of the program and talking about how helpful it is. And I'm sure everyone on here that works at a school can testify that you may have the principal is the grant writer, the principal does this, the principal does that. One person is doing everything and they don't have the bandwidth to do it. And they even said at some schools that they may have a mental health professional, but is one mental health professional for 700 students. and how effective is that? So this will give schools the opportunity to put these plans into place to make a difference. So I hope that you guys take advantage of it, and I can't wait to hear about what happened as a result of that. So just to share a couple of resources that I come across, Governor State University next week is having a wellness week. You can scan the QR code and it tells you about all the events that they have going on next week. They're all free. You don't need to RSVP. There are some fantastic activities that are coming up in the community next week. Also, there is a food giveaway tomorrow in Blue Island at the Beggar's Pizza. It is free. There's no residential requirement, so feel free to come out and take advantage of that. I shared this once before, but this is a resources for free tutors based on your school district and your eligibility from Varsity Tutors. You can contact the contact person on the slide to see if your school or school district is eligible for this resource. We have some updates on EpiPen and albuterol. This will be brief, but then we have someone from chronic disease who will come on a little bit later and give a little bit more detail. As I stated earlier, I'm no longer the contact for the program. For those of you who have been emailing me, you are getting an automated message, and I hope that it is sufficient to send all requests to the Healthy Cook email, and they will process your request. But Keith will be on a little bit later to give you a little bit more detail on the updates to that program. For those schools who are automatically enrolled in Rescue Illinois and do not need to request a prescription from us at Cook County Health Department, you will contact Naomi Soto at the Asthma and Allergy Foundation to get more information on that program. If you are interested in receiving Narcan from your school, Denise Holman from Cook County Health Department in our Behavioral Health Unit is in charge of that program, and she is the contact person, and here is her contact information to request those resources. Just a few communications resources. These have not changed, and we are still pushing the phrase boost up. And we're just not speaking about COVID boost up. We want to make sure that everyone is getting all the vaccines that they need, whether it's your flu shot, your back to school immunizations for us old folks, shingles. We want to make sure that everyone is getting all the things that they need to stay healthy. So here's some resources and information on our website about how to stay boosted up, with some accompanying flyers and information that we have been sharing throughout the pandemic on proper ways of wearing masks and how you can keep yourself safe. Some governmental resources on vaccines and some things you can do to keep yourself safe and your family. The government is still offering free COVID tests at home if you find that to be a well resource. They are still giving out 4 free tests from this website, as well as Cook County Health Department is still taking requests from organizations for rapid tests. Here's some other vaccination resources that I shared last year of some mobile vaccination organizations who can come out to your school or your organization to help facilitate some of those wellness events. As well as IDPH has a Wellness on Wheels bus. The request form is within the link, and you can request that for your organization as well. Couple more resources. American Red Cross has an emergency preparedness program for schools and youth programs to help children understand how to be prepared in an emergency, as well as some mental health resources from our partners with The Loft, NAMI Chicago, information on 988 suicide crisis line, as well as the 211 nationwide resource line. You could text, call, or email to get information for this line, as well as some information for our partners at Sertoma. They have outreach to the homeless and mental health services for youth and adults, as well as they now have a living room that is open during the hours that are listed on the flyer. You can just go and get some mental health support and a little respite. And also, finally, our partners at the Forest Preserve has a free transportation to the Forest Preserve with lots of events. We had a representative from the Forest Preserve here for our last meeting for the before the summer to talk about all the great offerings at the Forest Preserve. If your organization or your school needs a ride to these events, you can request that from the Forest Preserve. That is it for me. I want to thank you all for listening. I'm going to call Sheila for her first update for the school year and give your communicable disease update. Hi, Sheila. Good to see you.
Hi, good to see you as well, Callie. How are you guys doing today? I am going to go ahead and present. Please let me know when you're able to see my screen.
It's showing.
Okay, thank you. So, good afternoon. And again, thank you, Callie. Please note you definitely will be missed. So, welcome back and a warm welcome to anyone joining the webinar for the first time. Just want to take a moment to talk a little bit about the Communicable Disease Unit and tell you a little bit about our purpose for being here and what you can expect during our time here doing this meeting. So, oftentimes you will hear updates from VPD staff, and we actually utilize this platform as our communication channel to keep you abreast on any new information from us or IDPH, to communicate if there is any community or national outbreaks, or perhaps just to discuss if there is any increase in vaccine preventable diseases within suburban Cook County.
Did we lose volume?
I think you muted yourself, Sheila.
Oh, sorry, can you hear me now?
Yes.
Okay, my apologies for that. So, in late May, the CDC issued evidence based recommendations for preventing the spread and the transmission of infections in K to 12 schools. These guidance provide the latest and the most up to date information. This guidance details practical measures that schools can implement to effectively prevent, manage, and mitigate the spread of infections within schools' environments. It is important for me to note that this information and these recommendations, they do not introduce any new information, but rather it focus on advising on when the implementation of layered strategies can benefit to help reduce the spread of infections within your school environment. So the links presented before you are from the CDC, and you can find with these directed links everyday actions to prevent the spread of infection. They provide guidance and best practices on when students and staff are sick. It gives information on standard managing school operations. Some fact sheets, which is a here's one here now that can be shared within the school setting and or with parents, and also just other resources that are very helpful as you begin to navigate ways to help protect yourself and your students in that environment. But I do want to just take a moment to point out bullet number 2. It is the emergency operation plans and sustaining partnership videos. Let me tell you, I have spent the last few weeks watching a lot of these videos, and it has a wealth of information that I know that would benefit you guys. One thing I did want to point out is the emergency operating um, plans, EOP. It gives you the opportunity step by step to build out your own emergency operation plan. And if you have one, it also gives you information with the newest guidelines and recommendations to make tweaks to those emergency operation plans. These can help you plan for any outbreaks, endemics, pandemics that you definitely may experience in the future within school and community settings. I personally think the EOP is extremely essential as a valuable tool that you can put in your toolbox to help you prepare for these things. So, the emergency operation plan is just one of the modules that is available for you here under the partnership videos. They have information available on grievances within a school, like shootings. It have information on foodborne illnesses within school settings. It's just a bunch of different videos. I do want to make note that the videos are between 30 to 45 minutes long. So whenever you have a moment, please take time to click on this link. It will ask you for your email address. It would send you a code. You enter the code into the system, and it would open up a platform of several different videos that you can watch. And I know that you would definitely find them as beneficial as I did. Again, a great wealth of information. And I personally love the emergency operation plan that walks you step by step on how to build out one. So as I alluded to earlier, this is the platform that we will use to keep you guys up to date and abreast on what's going on in suburban Cook County. So this chart here presents a slide-by-slide comparison of pertussis cases. Want to definitely note this is suburban Cook County numbers, and the comparison is from 2023 to 2024. It is evident, if you're looking at these numbers just as I am, that 2024 already has a multitude of more cases than what we saw in 2023. Keeping in mind that we're just starting off in September, so this is like the first day of data for September. So we've already surpassed this number for our September compared to 2023. So, according to CDC for 2024, reported cases of pertussis increased across the United States, just not in Illinois and just not in suburban Cook County, across the United States. So, this indicates a return of a more typical trend for pertussis cases. So, as Dr. Joshi has stated, I know many of you guys have been in school for weeks and perhaps even a month. I know that you guys have started to see a elevated amount of pertussis cases within your schools. We've been working with many of you guys, but I just want to keep you guys abreast, especially since we are entering respiratory season, that please be mindful and be prepared to expect to see more pertussis cases than you have in the previous years. So why do I say school environments and why do I say you guys, right? So this is our pertussis cases by ages for suburban Cook County only, but I pulled data all the way from 2016 to current 2024. And as you note, ages 0 through 5 and ages 16 to 30, which couples those ages for some of our schools, every year we have seen higher cases than any other age category for pertussis cases. And as you know, 2024 is no different. So wanted to provide this data for you so that you can note the age category for where we're seeing the most cases of pertussis in suburban Cook County. So as we inspire to keep you, meaning our residents and our school, healthy, we do invite you to reach out with any questions or concerns that may arise this school year. You can contact our team at the email address provided here. I do also believe that Kelly mentioned this earlier for you guys. Please reach out and we will do our best to help you in any way that we can or to guide you in the right direction to best get your questions and concerns answered. And also, please know that we are here to provide some resources or guidance and also offer school letters in regards to pertussis cases as needed. I have asked my colleague to drop a link in the chat that provides you just the general information on pertussis so that you can have that as well. So thank you so very much and cheers to a healthier 2024-25. Thank you, Callie.
Thank you, Sheila. That was fantastic. If you guys have any questions for Sheila or her team, do as Dr. Miles has done and put the information in the chat. We'll be more than happy to follow up. And I would just like to welcome Keith Wynn from our chronic disease unit to give you guys an update on EpiPen and albuterol program. Welcome, Keith.
Thank you so much, Kelly. Do I have access to
Yes, you should be able
share
to
my
share.
screen? Oh, it's It's blocked for some reason on my end.
Kelly,
Okay.
it says only meeting organizers and presenters can share.
Oh, well, that's good to know. Thank you. Okay, I'll share your screen. Thank you.
Thanks, Kelly. Thank you so much. Thank you. Well, hello, everyone. And once again, as Dr. Joshi mentioned, just want to thank all of the various school staff and representatives who are on today's call and meeting. We can't thank you enough for taking time out of your busy schedule to participate in this virtual school health meeting. As stated, my name is Keith Wynn, and I'm the public health educator with our chronic disease unit here at CCDPH. So for many years, CCDPH has always wanted to improve and streamline its process for requesting EpiPen and asthma medication. So those of us, but primarily a lot of the school nurses who have been involved with the project since its conception, have experienced several ways of submitting requests for these documents. Some have contacted us via email directly to a CCDPH staff, and others have used the Healthy Cook email address. And I'm here to announce today that CCDPH has currently updated its request procedures and process for these prescription and standing orders. And what this process includes is it's an online update process um, that allow be a little bit more efficient for school nurses to submit their requests, and on the back end allow CCDPH to better respond and also to better track those requests as they're come in. So again, what's new? So we've created a web page that provides a link to the our online request form. And if I don't know if I can try to click on this and see if that will come on or not. Yes. So if you can see my screen here, this is just a snapshot of our current asthma and allergy resource um, website for schools. It has information uh, about the undesignated medication here in Illinois. As we scroll down, it goes into the process for requesting these medications and standing orders for schools. We have information in here regarding the annual staff training requirements um, that are needed and as part of the Illinois School Code for accessing these resources. And you can see here there's a section for reporting the usage of those medications. If in fact a school district uses those, would have to use this medication. And then we also included just a couple other additional resources that schools can use. We have our standard SOP, and we encourage all schools to review and look at our SOP, um, as well as resources where you can access, the EpiPen medication, as well as the asthma medication as well too. Okay, all right, I'm going to come out of that. And I'm just going to briefly go over the instructions for requesting the prescription and the standing order. So as we've repeated, schools or the school nurse can just go online to request and access the prescription standing order form. We ask that the school nurse completes this request. And then we ask that you can just complete one form for each school within your school district. So this part is just primarily the same as most schools have been doing when accessing the medication or the documents. Schools have an opportunity to save their request form once it has been submitted. And then upon submission, you should get an automated email from CCDPH just confirming that we that we have received your request. And as always, we'll just follow up within 7 business days upon receiving your request. All the forms must be completed for each medication requested. So on this new online platform, you won't be able to select both. So you will have to go and complete one for epinephrine, and if you need another one for the asthma medication, then you would need to complete the online form for the asthma medication. We ask that schools now begin to identify and document at least 2 people, in addition to their school nurse, who could be trained to administer this medication. And once again, this just falls in line um, with what is highlighted in the Illinois School Code. And we just want to encourage that only the trained personnel should be in administering this medication if an emergency event takes place on a particular school campus. And these trainings should be certified by the school nurse, or if the school nurse of a school has any relationship or networks or contacts with a physician, they can be reviewed annually by these 2 professionals. And if any schools are experiencing any difficulties with the site, they can just send inquiries to the Healthy Cook email address there. And we have someone who oversees and views the Healthy Cook email address daily. And so if there's any problems, any concerns, we should be able to respond to your inquiries rather quickly. And then lastly, we did test out this early request form to a small number of school nurses. So again, small sample, but most of the school nurses have said that they found this new online platform very useful, and more importantly, really very easy to use. And lastly, I want to mention that CCDPH just recently sent out as early as this morning and reached out to any intermediate service centers and have asked that they please distribute this information to the schools within their regions through their various channels and networks. So, all right. And I want to say, thank you once again. Thank you, school representatives, for your time, and thank you, Kelly, for giving me a couple of minutes on the agenda just to share this update.
No problem, Keith. Thank you for that update. That's great information. I just wanted to bring to Tarek's attention that the pertussis document isn't able to be opened. So maybe the actual document can be put within the chat instead of the link. I appreciate that. That would be great. If there are any questions for Keith or any of our communicable disease partners, please feel free to put them in the chat. We'll make sure that gets answered. And I would like to welcome our esteemed partners with the Illinois chapter of the American Academy of Pediatrics, also known as ICAP. They are going to come on to discuss some of their statewide partnerships and outreach. Welcome, you all. Feel free to share. There you go.
Thank you so much. I'm very excited to be back. I was here a few months ago talking about our school health survey that we did back in the beginning of the year. So I'm very excited to be back. But to all the new faces, my name is Brandy Vogt Cervantes, and I am with ICAP. And my manager, Caroline, is also here in the chat. So if you have any questions during this, please feel free to type them in. She's very intelligent in all these things and very well versed in everything, can totally answer all your questions. But we're just going to go over some of the projects we have in relation to school health today on this wonderful Friday afternoon. And the main project we're going to be talking about for a few minutes here is our coverage grants. And this program has the goal to reduce barriers to receiving required school immunizations. And the Southern District of Suburban Cook County is included in one of the target regions for this. So this is targeted for specific areas where throughout the state they've seen lower compliance for some of these immunization requirements. So we are all throughout the state. So if you have any colleagues who are maybe in some of these other regions, we would love to hear from them for some of these projects that we have going on. And currently, we are near the end of our coverage work group meeting, which we actually have a few members of on this call currently. So shout out to all of you. We appreciate you so, so, so much. And the goal of this group is to really talk about different things and raise awareness on different ways we can increase vaccination acceptance rates and these coverage levels in these identified communities. So all these partners represent those targeted regions mentioned on the previous slide. And we are made up of more than just school nurses, but we have so many wonderful school nurses on that group. We also do have pediatric providers and health department representatives that are there as well. And the whole goal of that project with that work group is to address some of these specific barriers that were actually brought up during this school health survey that we did earlier this year. And just as like a little sneak peek, I will probably be coming back to also mention all of this because we will be coming back and doing another round of that survey at the beginning of next year, which is very, very important that we get as many pieces of feedback as possible because it's so important for this work group. And there's a lot of data on this slide, but the main takeaway from this slide is just how when we did receive feedback from school health nurses throughout the state, the main barriers to vaccination, which are probably not a surprise to anyone on this call, but we still heard a lot of feedback from providers and nurses at the schools about issues of insurance, the rise of these religious exemptions, transportation, language barriers, and a bunch of other things. And so we worked together with this work group, as I previously mentioned, to try to come up with a way to address some of these issues. And one thing that isn't mentioned on this specific slide, but was mentioned in our survey, as you may recall, as if some of you might have taken that survey, was what was a potential way to help address some of these barriers? And one of the big results we heard from people was actually talking to school administration and how there's a little bit of a disconnect of support between some of those individuals and the school nurses and what they really need. And then, of course, additional education for parents, support from local physicians and clinics, as well as just additional, maybe not education for parents, but just more accessible knowledge to parents. We've heard a lot about, having things at open house nights and things like that for parents in the communities. So what we're doing with this is we are making a media campaign as one of our activities, which is part of our grant requirements. And the media campaign we're trying to use in a bunch of different ways. We're going to have audio ads on apps like Spotify and potentially like YouTube ads to try to reach parents and adolescents, as well as like traditional social media ads and like your printed direct media, direct mail promotion. And the whole goal of this is to increase autonomy for some of those older adolescents, to kind of help them create their own decisions, but also empowering parents to help understand what their student or their child would need to make sure they're compliant with all these different policies. And these will be in a multitude of languages. So right now we have them in English. They're being developed in English, Spanish, Polish, and Arabic. But if we have anyone who might know any other languages that we should make these adaptable to, please, please, please feel free to email me or Caroline or put a message in the chat because we're always willing and able to create these materials in more languages. And for this slide, we're expecting a lot of outreach for this. We work with a really awesome digital media firm called O Creative. And of course, since we have specific regions of the state that are prioritized for this grant, we will be making sure that these materials are focused in these regions. So we have the Southern District of Suburban Cook County, West Chicago region, we have Champaign, Peoria, and Rockford. And they're expecting us to hopefully reach around 16.2 million impressions. So it's just like every time you like see something, so not necessarily 16 million people, but it would be seen hopefully around that many times, which is really, really exciting. And what one of these campaigns are, which we're making one specifically addressed towards school administration. Again, this was a big thing that we heard from our work group, as well as just in that initial school health survey from school nurses. And what we're really hoping to do with this campaign is remind school superintendents, as well as different administrators, including principals, to really enforce some of those state and district vaccination policies to make sure that all students are compliant for safety of all other students. And so some of the outreach things that ICAP is currently doing, as well as developing, is targeted email campaigns. So we have already sent one to all superintendents in the state of Illinois at the beginning of last month, so right as school was starting to start. And we also had the support of IDPH's school health program. They sent out the similar message, just in like a fancier letter format, to principals as well as some school nurses. So if anyone is on that school health program email list, they might have received that from IDPH on behalf of us. And we're also making a printed letter to send to school leadership that we will be mailing throughout these different targeted regions of the state, as well as a template that these schools can be printing or emailing or adding to their own, digital newsletters or whatever communication they have to parents and guardians in their school districts. As well as we will be making some social media ads, and we actually have a sample of one that we have drafted here on the right-hand side of the slide. So some of these will be on LinkedIn, other apps called Nextdoor, and then of course traditional social media as well. And we also have a really exciting partnership with IDPH that we are currently building up. They're very eager to get involved in this with us. So it's a cohesive interdisciplinary message from multiple entities throughout the state of Illinois. As I mentioned, they've already sent out that letter to principals and school nurses to really reinforce that message, but also we're going to be developing a toolkit specifically for school administration and administrators with IDPH, but also ISB, HFS, and IAFP. So unfortunately, that's not going to be ready for this school year. We're already nearly a month into the school year, but we're hoping to have it ready to go by next school year to really help, right when registration and everything's starting, and as summer ramps up next year, have that be going out throughout the state. And another fun thing that we just launched on our ICAP website is we have a new global vaccine schedule comparison chart. And this was something that was also a major barrier for a lot of school health nurses and staff. They're having some new arrival students at their schools, and a lot of their vaccine records were in different languages or from different countries, and they weren't necessarily sure how to interpret those to make sure that their students are compliant or what they would need to have completed for their vaccination records. So if you scan this QR code, and I can also put the link in the chat at the end, but this is something that we have that is free, and it's actually comparing 10 different countries to the current ACIP recommendation schedules, or the ACIP vaccination schedules. And it's a really great tool. It's available as a Google Sheet or an Excel document, and there are instructions there on the actual document, but also all over our website. It's a really, really cool tool. We worked with really amazing partners to develop this, and we're planning to continue to update it as time goes on. And it's just a really awesome tool that is available to everyone. And next, we have a very exciting return of our mini grant applications, which I know were a very popular thing to apply for last year. But these grant applications are open for a few more days. And if you scan this QR code, you can open up the application, and I can also put it linked in the chat as well. But this is limited to those working in that southern suburban region of Cook County, for the sake of those targeted regions. But if you have any colleagues or know anyone who works in one of those other targeted regions, they are more than welcome to apply. That link, that QR code will give you all the limitations and what these grants mini grants can be used for, but it is to help address routine childhood vaccination barriers. And you can apply between $1,000 and $2,500 per project. So it can be used for a variety of different things. We had great things applied for last year, like mini fridges to help keep vaccinations cold, or to pay staff extended hours to try to vaccinate at school events. We had a great clinic send us some pictures of students at a school basketball game that had extra immunization materials there during that game. So that was really cute that they shared that with us. But that will be open, like I said, for a few more days on our website. And that is all I have for this. I wanted to make sure I didn't go over time today, but thank you so much, everyone. And I will be sure to put those links in the chat.
Thank you, Brandy, so much. We would have sat here and listened intently if you went over. It's perfectly fine. We appreciate you. That was fantastic information. I appreciate you and Caroline's partnership. If you could put your email addresses in the chat, I'm sure people would love to know how they can reach out to you all and find out more information on ICAP. And it is fantastic. If there are any questions, please feel free to put them in the chat. We have our links for ICAP information in the chat, as well as Alicia shared the Pertussis document that was so popular. I also put in the chat the link for registration for our October meeting. And while we are waiting on that information in the chat, we also have Dolores's contact information in the chat if you want more information about the focus groups for our community needs assessment. Finally, for those who may have joined later, this will be my last meeting until next year. I am going on leave for a couple months, but we are in good hands because Marcia McCullough, Stacy Diggs, and Alicia Boyd will be covering the meetings, so you will not miss a thing. And before I forget, Brandy and Caroline, you are more than welcome to contact us and come back whenever you have an update. We'll make time for you, and we would love to hear any information you have about that update. As I stated before, we will not be emailing out the slides. However, we are in the process of updating a SharePoint site that will house all of the resources that we have. It will have links to our recordings. It will have webinar registration links, as well as all of the handouts will be uploaded onto the SharePoint site, and that way you can just access it at will. We're hoping that our communications unit has that up and running next week. I will make sure I send out an email to all participants with that link when it is up and running, and we'll be sure to reiterate that at future meetings so everyone can get used to the new changes. We're trying to make things more streamlined for you and our communication, and we think that is a great first step, as well as the automated feature for requesting EpiPens and albuterol. Is the rescue program still providing inhalers? I gave Naomi Soto's information in the slides. I'll make sure that's in the slide deck as well. But let me look it up real fast, and then I'll give you her email address, because Naomi Soto with the Asthma and Allergy Foundation is the contact for that program, and she can give you that information. Just give me 1 second. Let me pull up her email address, and I'll put it in the chat, and you can reach out to her. You should still be receiving your information from that. And if you need it, oh, yes, Naomi Soto is her name. If you need any information regarding any here's our information. If you need anything regarding your shipments or have any questions about how the program works, you can make sure you contact Naomi Soto with the Asthma and Allergy Foundation. She is the contact for Rescue Illinois. Rescue Illinois is the program for some schools who qualify that will automatically be sent that information for as far as, and the resources for your asthma and allergy rescue information. You do not have to request it from Cook County Health Department. So feel free to reach out to her to get any of those questions answered. We had a jam-packed meeting and we stayed within time, which I'm very surprised by, but I want to take the time to thank you all. And I am so glad that you are here. I hope that you had a wonderful start to the school year and things have calmed down a bit. I know it's very hectic in the beginning. We will be here next month. Our next meeting is October the 18th. The link to RSVP is in the chat, but all those links will be on our SharePoint site, as I previously reiterated. If you have any ideas for any webinar topics that you're dying to have us put on, feel free to reach out to us, and we'll make sure we work really hard to bring that to you all, because what our community needs is what we are here for. That is what this engagement is for. The SharePoint site is not active yet. The SharePoint site should be active within the next week. And once that is active, I will send that link to all registered participants and our contacts, so we can make sure that everyone has that information. Thank you all, and you be well. Enjoy this summer-like weather. I was happy a couple weeks ago when it was more like 70, but I'll take it. But be well. Good that we're not in the South and it's not a hurricane. So enjoy this summer-like weather. Be careful. We will see you soon. Feel free to reach out to any of us who have any questions or anything. Thank you so much, Michelle. At least I will be off for the Christmas. Thank you all. Some good stuff coming on TV, so I'll be occupied. Thank you all. You take care and be well. I'll talk to you soon.